I think this agreement is more about helping the employer than it is helping employees. One of the things that you notice on the first page is that the actual contract language has not been agreed to. It's going to be written later on. Here, people are voting on something that they don't even know what's actually going to be the ultimate language that is really going to govern so much of their lives, their working lives at Kaiser. It's more about Kaiser and how to benefit Kaiser as opposed to how to benefit the workers that work at Kaiser. What SEIU immediately says, oh, don't worry, it doesn't go into effect until 2017. It says the retiree medical plans will be amended 2012. So Kaiser's done it, SEIU's done it. It's in cement at that point. If there is a cap on it, that means that Kaiser then at some point is going to decide, I guess, in concert with SEIU, how they're going to contain costs. And it can only mean higher co-pays, cost sharing and premiums, or reduction in benefits. I think this really is probably one of the most draconian deceptions to workers that I've ever seen. I think in their little secret meeting when they made this agreement, they agreed no matter what, we are going to put a cap on what we're willing to pay for retiree health. And who cares about the workers? Kaiser puts a certain amount of money into the LMP trust, and then the members will have to put a certain amount of money into the LMP trust. Kaiser's amount goes down over the 3 years of the agreement. Kaiser will contribute in 2012 $6 million to the LMP trust. Then it goes down to $4 million. Then it goes down to $2 million. So that means that the workers are going to be picking up the brunt of that cost. They're going to be obligated to pay the 9 cents. And then for our folks in Southern California, when they get their 3% increase, their dues is going to be increased. In January, the folks in Northern California will have their dues increased as well by $4. And what benefit are they getting from it? On the wage increases, the 3, 3, and 3, in the 2005 agreement, we were able to do away with 2-tier throughout Northern California. And in fact, we began bridging the gap between the wages in Southern California and Northern California by giving the folks in Southern California an additional increase of 4.23%. That's not even addressed in this contract, which really means that it's Kaiser's intent, SEIU's intent, to maintain this difference in wages forever. Someone in the North might say, well, it doesn't affect us, but it does. Because the longer folks in Southern California earn less wages, it's less likely that Northern California folks can ask for more wages, higher wages. There is about a 10 to 13% difference in wages between Northern and Southern California. It's really a 2-tier system that SEIU appears now to want to maintain, as opposed to what we were doing, and that was bridging the gap between the North and the South. By the end of this contract, it will have been 10 years since this bargaining unit has actually been able to bargain on a local basis. When members want to bargain over changes in their job descriptions, in what's expected of them at work, shift differentials, all kinds of different things that workers want to bring up on a regular basis in bargaining, they will not be able to do it for a full 10 years. All of the discussions in bargaining of any substance were held behind closed doors with no bargaining committee people present. So no one knows what promises were made or agreements reached, because all of the discussions took place without a member present. There's going to be peer pressure on folks Why are you so fat? Why do you drink? Why do you smoke? It's going to be very invasive, very intrusive in the lives of workers, and it's going to be supported both by SEIU and Kaiser. It's very clear that SEIU and Kaiser could potentially agree later on, if this incentive doesn't work, that they might do what other employers have done, and that is penalize workers by forcing them to pay part of their premium for their health insurance because they are not meeting certain wellness goals that the employer sets. All of us want to promote healthy living, but it really is done on an individual basis. It cannot be done organizationally. If there's pressure from their coworkers based on an incentive that they might get, I think that becomes a negative. It becomes divisive among workers. You know, people have said, is SEIU in bed with Kaiser? Well, I think this is what that's about, is that SEIU is going to do everything it can to benefit Kaiser, because what Kaiser is going to do in return is, as it opens hospitals, it'll make sure that those hospitals are SEIU. That's what SEIU gets in return, is huge, huge amount of money. Millions and millions of dollars in dues. It's almost as if Kaiser wrote this agreement and not a union.